The government of Zimbabwe and other health stakeholders should share credible information about COVID-19 in order to avoid the unnecessary and unacceptable stigma and discrimination that we are seeing in our various communities. The lack of information or misinformation about COVID-19 is largely resulting in social stigma towards people with COVID-19 or survivors from COVID-19. This therefore calls for the government and other stakeholders to craft and communicate well thought out, non-stigmatizing and non-discriminatory messages to the general public. Zimbabwe cannot afford a repeat of the HIV/AIDS mistakes that were made in the late 1990s, whereby there was so much stigma and discrimination fueled by ignorance and the general lack of information, making people living with HIV more vulnerable. The worrying issue of fake news and misinformation on social media platforms is causing panic, fear, and stigmatization of people suspected to have COVID-19. Hence, the need for correct and credible information from the official sources. The effects of stigmatization are devastating, both socially and emotionally, and may result in further health complications. There is need to raise widespread awareness about COVID-19 without increasing panic and fear if we are to stop stigma and discrimination. So we call upon the government to speak out openly against any negative and discriminatory statements, especially by influential officials, as that can fuel stigma and discrimination. Therefore, a sustainable health system strengthening will be necessary for the post-COVID-19 pandemic recovery. We need to ensure that there is quality primary health care if we are to achieve universal health coverage and thereby strengthening our preparedness for future health emergencies.